talk about health then, should we?
I think first of all we're flying the Ukrainian flag behind us, really to mark the memory of those who died in the village of Hazoris today.
Yeah. Terrible cowardly acts by the Russians.
It was. So our thoughts are with the families of the people affected. Our problems don't seem quite so large when you think about what is happening in the Ukraine and other places around the world, but of course election time, we're examining all the policies, and today it is health. I'm Heather Roy.
And I'm Simon Ewing-Jarvie. Welcome to VoterTorque. So the health workforce is really at the core of this problem, isn't it?
I think it is, and all of the parties really have some initiatives to try and address that. They vary, and I think that there's quite some discussion about what might actually work and what probably won't. Easy for politicians to say we just need another 500 doctors or we need another 2,000 nurses.
Yeah, I mean, I think we kept the workforce going by a steady flow in and out of foreign clinicians, and the COVID lockdown stopped that.
It did.
And so it exposed the problem.
Yeah.
But if you're talking about 8,000 gaps, not just doctors, but across the workforce, and that growing at about 1,600 a year,
yes,
there's a crisis.
Yeah.
You can't call it anything other than a crisis.
And I think there are very few who would think that their interaction with the health system today is better or the same as it has been in the past. It's very hard to sign up with a GP practice if you move to particular areas. It's very difficult to get an appointment on the day that you need it, whereas once upon a time, with particularly visiting our GPs, we were used to that sort of service.
Yep.
It's very difficult to for the hospital sector to meet the wait times.
Yep.
And people really, I think quite rightly, are feeling that our health system is in crisis.
Yeah. So what are the parties offering to do about it? Well, there's a lot of point form policy statements, but there's nothing really much material here. We can see quite clearly, for instance, that if there's a change of government on the 14th, that the Maori Health Authority is a goner.
Will go. Yep.
And all the bits and pieces that sort of hung off like that, the iwi partnership models will be depowered and so on in health. What else are we looking at? The two main parties are talking about increasing the size of particularly doctors by both increasing the outputs of the two existing medical schools at Auckland and Otago, and also for National reinstating their idea, which Labour killed off, of a third health school, medical school, which is a graduate school, so you go there with a degree and learn to be it was going to be a rural GP.
But I think now they're talking about it just being specialists, to train specialists.
So if you ramp it up to produce, say, another 220 or 325, depending on which side of the debate you're on, is it still enough? No.
Look, I know we need more doctors, we need more nurses, and there's various things that we can do to tinker around the edges, but these policies do feel to me like tinkering around the edges. I don't think anybody is taking a long, hard look at the whole health system and trying to sort the problems out. You can imagine if you had a whiteboard and were starting from scratch, how would you design a health system that now needs to cater for a rapidly aging population, and one where chronic disease has become quite prevalent and hard to treat. So early diagnosis isn't happening. That needs to be a real focus. So that actually does require a lot more workforce at the front end and getting people to present earlier. At the moment, and particularly COVID exacerbated this problem, people are thinking that they're not welcome at their GP practice, and so a lot of people are choosing not to go at all and just making do with whatever is ailing them. Sometimes that's fine and it works its way out itself. Things resolve by themselves, but very often I think what's being missed are early cancers, early diagnosis of conditions like diabetes that become costly to the taxpayer and a terrible impediment to the individual themselves. So that's where the crisis lies, and I don't see any party actually taking stock of that. Very good, however, to see that there is a real commitment to do something about PHARMAC. Now, Labour, like many of its policies, could have been doing any of these things that it's promising in the last 6 years, and it has failed to do so. It's only at election time, when other parties are promising things, that that they can suddenly find money to do that. So actually I've set those promises aside because they feel like false promises to me. The other parties have the luxury of not being in government and so being able to promise these things.
Yep.
And so the proof of the pudding will be after the election, do they actually do these things? National Party's going back to a lot of what Tony Ryle had put in place as health minister, and I think he was very successful because he used to stand up and say, these are the 5 things that I'm going to do in the health system.
Yep.
And he did get immunisation up to 95%. That's now completely,
out the door.
fallen by the wayside. I think immunisation rates now, childhood immunisation rates, rested around 68% of the population, way down from that 95% that he did achieve as health minister, well, the system achieved while he was health minister, and in Māori and Pacific communities, that figure is well below that. I think that we've got a model that is 30 years old, and the decision about what is going to be funded by the taxpayer is still being considered as it was at PHARMAC's inception. But medicines have changed hugely in that time. Now we have biologics which actually are tailored to the DNA of people, and there's been no accommodation for that very vast shift in targeted drugs that are much more effective when the right people are being prescribed them. And so I think the way that decisions are made needs to change too, and the only party that's promising to have a look at the way that PHARMAC operates is the Actor Party.
Right. And what are they proposing? Just have a review? They're
proposing to have an independent review. There was a review done, but it wasn't independent. An independent review of the operating model, and I think that's well and truly overdue. That should have happened 15 years ago when biologics were new to the stage, and it was obvious that they were much more effective in treating conditions, including rare disorders, which are always the poor cousins and miss out.
And
Rachel Smalley actually has done a fantastic job of highlighting the problems with the current PHARMAC model and how people who shouldn't be missing out are. We fund about half the number of modern medicines, new innovative medicines that Australia does.
That whole Rachel's, I was going to mention her, the Rachel Smalley story, with the OIAs of the emails of that, indicates a very toxic culture inside PHARMAC.
A completely broken culture.
And so culture follows the CEO. There's no option really but to get rid of the CEO and bring a new room in to clean that place up.
They need a new decision-making model, and they need new people who can actually implement a proper strategy.
The tone in those emails was absolutely appalling for any public sector organisation.
It was.
Okay, so what else we got? The Green Party don't have to worry about actually paying for anything because they're not going to be able to implement the policy.
Well, they want to tax the wealthy to pay for everybody else. So they promise a lot.
If we hesitant from time to time, it's because if you're only listening and not watching, this is a wasp. It comes in and out.
Floating around.
Comes in and out of frame. We're going to have to reduce the wasp's health shortly.
But anyway, back to the Greens.
So the Greens will basically want an NHS model where everything's free for everyone.
That's right. They've always been very taken with the NHS model where people don't have to pay, the state pays for all of your healthcare.
It's a big thing. Te Party Maori are going to give it all away if you're under 60k, I think it is, if you're a low income family.
I mean, basically when you read their policy, it's about a separate health system for Māori.
They're talking about a Māori ACC.
Yes.
That's just insane, because it's an insurance scheme, so the cost is spread over the number of people.
One of the things that has been talked about in previous elections, and I certainly talked about this when I was ex-health spokesperson, was we shouldn't be differentiating based on whether you're sick or whether you've had an accident. So if you've got a health issue, it should just be there should be good quality access to the healthcare that you require. It shouldn't matter whether that was an accident and therefore covered by ACC or people who have a pathological condition always are less well catered for than those who have had accidents. and we need to get around that. So ACC actually works pretty effectively. It's pretty brutal in some of its decision making, but the model works pretty effectively, and I think that the rest of the health system could learn some lessons from that. No talk at all about this in any of the policies from the parties this year. So which I thought was interesting. I suspect they're probably all a bit gun shy, because the poor health sector was expected to come up with a completely new model in the midst of a pandemic situation, which has been very costly and also particularly unfair. And I think that does actually speak to the fatigue that exists amongst the health workforce. I think they really are feeling pretty battered, and quite rightly.
Yeah. There's a lot of movement around the age where you can get this and that. So cervical screening, 25 to 69-year-olds, breast cancer screening, what's that? That's going to go up under labour to 74.
Yep.
Endometriosis action plan. These are very, very specific things.
They
are tinkering around the edges, aren't they?
Well, it comes back to picking winners. Screening programs are interesting. There's a lot of science behind them, and actually politicians shouldn't be making decisions about these things. It should be the scientists who are guiding them. Breast screening, for example, it was lowered to 45, whereas if you speak to the specialists, they'll tell you that actually screening really isn't that effective until women reach the age of 50, and the upper limit of 65 was where they felt it was most effective to, and gave best bang for the buck. So decreasing to 45, lifting to 74, you're including a lot more women and cost into the system, but for very little gain. Cervical screening, some of the parties are promising free cervical screening. At the moment, women pay for that. Would we get her engagement? We actually need to look at the figures and see. My understanding is that pretty much most women are enrolled in the cervical screening program. So these things make great election sound bites. I want to see some discussion around effectiveness and efficacy.
Yeah, so, and on the national side, there's a whole little dollar points there, like $10 per GP visit more. Will that come off your bill? It's kind of like GST on fruit and veg, isn't it?
I think it is.
Sorry, Nick. And reinstating the $5 prescription fee and using that money to buy cancer drugs. That's the downside of that policy. That's just a switcheroo. Actually, why cancer drugs are not some other kind of drugs, that's not the government's business to worry about which drugs to buy. It's actually releasing the funds into a working model.
I think that particular part of the National Party policy is based on what's happened in Australia, and it's been remarkably effective. So I think this is a good thing to be promoting, but you're right, that again is picking a winner, and other chronic conditions like diabetes, for example, will still be left behind while the money is channeled into that only.
Arthritis. Arthritis and diabetes are the two big the two big tsunamis in the New Zealand population, right?
So we fund a lot of kidney dialysis because we aren't diagnosing diabetes early, and it's particularly prevalent in the Pacific Island community. If we were targeting those patients and getting them on effective diabetes medication early, the need for the kidney dialysis just would not exist.
Yep, and for Labor to come out and say they're going to build a new hospital in Hawke's Bay.
They must be worried about those 2 seats at
something
election
going
time.
on. Yeah, that's right. That's like the American process of giving defence contracts to marginal seats in it for congressmen.
Yeah. So where does that leave us? There's a whole lot of work to do in health, and I just see tinkering around the edges with these policies by and large.
So we've got to make it easier for foreigners to come here, but we've got to remember there's 6 odd million worldwide shortage, so they'll move around. Some of them want to come and ski and fish, but that's not every doctor, every nurse.
I don't think it's as simple as that. There's actually a worldwide shortage of all of these specialists.
Streams,
And so Australia is having the same problem. It's trying to attract doctors and nurses and other health professionals from overseas. They have a much higher standard of living than we do currently. They offer those people a lot more money for those jobs. Why would anybody come to New Zealand ahead of Australia under the current scenario? And so we need to fix our economy. That's the first port of call.
That's where everything gets back to. But it's got to be easier for people who are qualified overseas to get registered here, and that's regulatory barriers. It's it
comes back to our registering
like
bodies.
Our medical council and the nursing organisation, and then the Royal Colleges
who operate in very protectionist ways frequently, and they have been hauled over the coals for that in the past, but their behaviour hasn't changed.
No.
Yeah. There's no reason at all why New Zealand should think that it has to have the best qualified doctors in the world. Yes, that's a great target to aim for, but we put up an artificial barrier for very well qualified doctors and nurses to come here when it's unnecessary.
It's unnecessary, it's unrealistic, and quite frankly, it's arrogant to think that we can teach better than anyone else in the world.
And we haven't touched on psychiatry, which mental health is an absolute crisis. People who desperately need it cannot access the care that they need. And a report came out this week saying that we need double the number of psychiatrists and psychologists that we currently have. Now, you just can't materialise these people out of nowhere. It takes 12 years to train a specialist. And so we needed to be thinking about these problems a long time ago, but the best time to start is now, so we need to also be addressing these specialist areas.
One of the parties, I can't recall off the top of my head, is saying that, you know, of the new batches of doctors being produced, a high percentage, more than half, are going to have to be GPs. You know.
Yeah,
they say no.
General practice actually has to be a much more attractive place to work if that's the case. And another of the parties, I think it was ACT, is going to increase GP funding by 13%, which means GPs will be paid more. That's what will speak to them.
Yep.
Yeah.
Yeah, and the low point in the policy debate on health at this election has to be from Labor, relating to the regulation on the number of vape stores and their proximity to different things like schools, churches and
they will allow 600 licensed stores countrywide.
Yeah.
That's going to fix all of our health woes, isn't it?
Yeah, well, I know there's a problem with kids vaping.
Yeah.
But really, try and make the stores a bit safer for the proletariat owners for a start.
And actually, people say the science isn't out yet, but tobacco is much more harmful for our young people.
Yeah. Oh well, I mean, I suppose they're going to be able to have, you know, cannabis gummy bears in under the same licensing regime.
Maybe they haven't gone there at all this election.
No, it's funny.
I mean, it's quite depressing if you let it be, and I think, you know, the message to most voters is stay healthy.
Yeah, that is.
Go for a walk.
Yep.
Join a gym.
Okay, well, get your questions in. We've got time for one more question episode before the end of this season. Don't forget to vote. I'm Simon Ewing Jarvie.
I'm Heather Roy.
See you later.